We have all heard of plastic pollution, but what happens when that plastic enters your body? Microplastics are tiny plastic particles smaller than 5 millimeters in size, not visible to our eyes, but they silently get into our body through the food that we eat, through the water that we drink, and through the air that we breathe. They don't just pass through our body, but they silently accumulate in our lungs, blood, even reproductive tissues like sperm and the follicular fluid. So here is what science is telling us. Number 1 is hormone disruption. Microplastics carry toxic chemicals like BPA, phthalates, and dioxins, which are endocrine disruptors and can mimic and block the natural hormones in our body. They can cause early puberty, infertility, thyroid issues, and even increase the risk of certain hormone-dependent cancers. Number 2 is inflammation and oxidative stress. When these particles accumulate in the tissues, they trigger a constant state of inflammation, which are again linked to chronic fatigue, autoimmune diseases, and even heart disease. Number 3 is gut and immune damage. The microplastics disrupt the lining in our gut and also affect the gut microbiome. What that means is that it weakens your immunity, increases the food allergies, and can affect the absorption of nutrients from the gut. Number 4 is reproductive toxicity. Found in sperms and the egg environment, these microplastics can affect fertilization, quality of the embryos, and even long-term reproductive health. Number 5 is increased cancer risk. The chemicals that come along with these microplastics and the endocrine disruptors are now being studied for their link to certain hormone-dependent cancers like breast cancer, endometrial cancer, and even prostatic cancer. So although these particles are invisible, but they are silently damaging our bodies. And the most dangerous part is that they exist in us even before we know. I am Dr. Ajesh Raj Saksena, cancer surgeon, and do help us share awareness for healthy being.